National Nutrition Natural Health Reviews. 3 minutes of the latest naturopathic info with Canada's leading nutrition experts. Watch, learn, and get healthy naturally.
Hi, I'm Dr. Jonathan Beatty, naturopathic doctor and a health expert here at Nationalnutrition.ca. Today I want to tell you a little bit about a condition known as angina. Angina can be quite a serious cardiac condition. It's actually characterized by a lack of blood flow to the heart, and this results in the development of chest pain. There's a couple different types of angina you need to know about because really angina can be a sign of impending doom or impending heart attack. And so understanding which form of angina you have can literally save your life. So the first one we're going to talk about is stable angina. Now stable angina is what we would consider a predictable angina. So that's when you have some sort of chest pain that's often related to some sort of activity or physical exertion, whereby you're increasing the demand of oxygen to the heart. And when your body cannot adequately supply that oxygen, it's going to cause a spasm of the muscles, and it's going to actually, or of the arteries on the heart, that's going to create a form of chest pain that we call angina. Now that is usually a predictor that you are likely to develop a heart attack in the near future. So it's a sign that you're developing a heart attack, or you're going to develop a heart attack, you're developing heart disease, and it's really that moment at which you should start to take action about your health and your cardiac health. Now, if you have the more serious form, which is called unstable angina. Now, unstable angina comes on at any particular time. It's all manners of severity, so it can be very severe pain. It can actually be very minor pain. But if it just comes and goes willy-nilly as it pleases, oftentimes if it shows up at night, that's a sign that you may actually be having a mild heart attack, and you're likely to have a heart attack in the very near future. So I do recommend, if you are having an unstable version of angina, call 911 or go to your local hospital for treatment. Now, acute treatment of angina is typically done with a class of drugs called nitrates. The most famous of these is nitroglycerin. So we actually take nitroglycerin often as a sublingual spray or a sublingual tablet, so that means under the tongue. And what it does is it causes the arteries to expand, thus preventing the spasm, allowing more blood flow to the heart, and allowing better delivery of oxygen to the heart, and then the resolution of the angina. Now, it's just a temporary fix. The nitrates do not actually repair the cardiac damage. They're just relieving the symptom of the spasm in the heart. So this is where it's still important that even though you might have been prescribed nitroglycerin or a nitrate drug to manage your angina, that you do take steps to help improve your cardiac health overall. The other thing with nitrates is that with repeated use, your body can become less sensitive to them, so the drug actually becomes less effective over time. And so this is why it's so important that when you have angina, you start to take steps to manage your cardiovascular health. Now, there's a few ways you can go about doing that. So if you're experiencing angina, you're getting that chest pain, it's time to start looking at the way we eat, how we manage our stress, and how we're exercising. So those are the 3 big tenets we're about to talk about. Now, one of the biggest things that I often recommend for angina is increasing vegetable content in the diet, specifically what I refer to as the aerial portion vegetables. So that part of the vegetable that grows above the ground, typically very high in nutrients, very low in calories, and often contain a lot of ingredients that are very alkalizing. And the reason that alkalinity is important here is when your blood becomes a little bit more alkaline, it actually gets better at, and more efficient at transporting oxygen. So you're improving the oxygen delivery to the heart, reducing the likelihood of experiencing angina episodes. Additionally, you'll want to start exercising. Now, obviously, if you experience angina with exercise, you're going to have to start very slow. You know, it might just be walking the stairs in your house. It might just be, and doing it in intervals. Okay, the idea is not to induce angina attacks. The idea is to slowly redevelop some oxygen delivery and improve blood flow to the heart. And actually, if you rest too much, it can actually cause the angina to progress faster. So by having some physical activity in the day, not enough to cause angina, but hopefully enough to just get a little bit out of breath, you'll actually strengthen your cardiovascular system. And then of course, last but not least, is in modulating your stress. So if you have known stressors in your life that you can control, try and avoid them. Okay, if there's no way of actually controlling that stress, let's say it's something completely out of your hands, then I would often recommend going and speaking to somebody about some sort of supplements to help manage your stress. Oftentimes even taking B vitamins, and especially magnesium, because it can allow the cardiovascular system to relax, can help, again, manage the angina that's induced by stress in your life. So these are some of the helpful tips that you can use to manage angina. And remember, if you are experiencing the unstable version of angina, please do seek medical attention, as it can be a message from your body that a heart attack is imminent, and it's trying to get you to start to take action, take control of your health. So if you like this video, please check out more at our channel, subscribe, and if you have any questions or comments, please feel free to post them below. And always remember, knowledge is health.